Coming to the types of respiratory failure, I basically remembered all four types of respiratory failure: type 1, type 2, type 3, and type 4. Okay, how I remembered is type 1 is basically the oxygen decreases. So in type 2, what happens? Like it's like a second stage, you think. So basically, oxygen decreases, its opposite molecule becomes increasing, the bad molecule, that is hypercapnia. So second one is hypercapnia, first one is hypoxic. So the type 1 and type 2, you do medical management. Think like that, hypoxia and hypercapnia, medical management. Second is, third one is surgical management you do. Like it's more stronger. So that's why surgically induced thing. I'm telling you extra. And type 4 is like even after surgical management, it's not working. So that's why it's type 4. That is shock related respiratory failure. Okay. Coming to this, because carbon dioxide is accumulating, what happens? There is metabolic acidosis. So acidosis, as you know, it will cause a vasodilation. Vasodilation, that's why peripheries are warm. So and it also, what happens? The BP, the diastolic blood pressure decreases, and SBP increases. So that's why there is wide pulse pressure. So think that metabolic acidosis is similar to the diabetic ketoacidosis, where here drowsy and comatose patient only will be there, even in DKS. So that think like that. Okay. And also, what happens here, mainly O2 is decreasing. So that's why mainly the perfusion oxygen, the living food is only decreasing. So that's why cyanosis is there. Here, if there is increased carbon dioxide, does not mean the cells are deprived of food. Only the bad food is increased, the excreta is increased. So that's why there's no cyanosis. And also, whichever conditions where the like carbon dioxide is persisting inside the body, like big barrel chest and all, so COPD, obesity and all, there it will be type 2 respiratory failure. Yeah, it's very easy. Even in ARDS, what happens? ARDS, hypoxia, all these are primarily oxygen deprived conditions. Okay. COPD is mainly CO2 retention. And coming to the features of carpulmonary, obviously I told this is the right ventricular failure, secondary to the whatever lung disease it's coming. So that pulmonary hypertension is happening, so blood is accumulating here. What will happen? So that's why it will dilate. So right ventricular dilatation happens. So that's why there is a parasternal heave. You should know that very basic of cardiology is parasternal heave is mainly due to right ventricular pathology of left atrial pathology, RV or LA, mostly RV only. Okay. Pathology, mainly it will give rise to epigastric pulsation. This is mainly cardiology integration. Right ventricular failure, when this ventricle also fail, what happens? All the blood will backflow into this JVP. So that's why raised JVP, all the backward symptoms will come. Heart failure symptoms, that is the pedal edema. First hepatomegaly happens, then ascites happens, then finally whatever pedal edema happens.